smiling.
First impressions are priceless.
I'm Dr. Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
I'm Dr. Levine, and thank you for visiting with us today. Welcome to Health Talk. This is our very first show. I want to remind you that this is not a show about dentistry. I just happened to choose two of my best buddies here to be on this show with me. We're going to talk about all phases of medical care and how it interrelates with each other. I work in a team. I'm a surgical specialist, and the general dentist, the restorative dentist, makes the beautiful teeth. I want to go back to Dr. Escabi and Dr. Garcia to talk a little bit more about what they do. And you guys speak Spanish, don't you?
Sí, señor.
You do? Okay.
That's our first language.
Okay. Well, talk about that and talk about, other things, because, dentistry has changed so much. When we were in school, at least when I was in school, we had to cut a lot of tooth away to create beautiful teeth. And they weren't so beautiful back then. Now, with the bonding materials, a lot more tooth structure is saved, and the materials are better, and it's a lot more conservative.
Right. Like when I went to school also, we were told basically to create a preparation to fit a restoration, but sometimes you had a small cavity, for example, and you had to remove so much tooth structure just to get to the decay,
right.
And then you end up with a tooth that is, the structure is compromised. Now we have newer materials, with the bondings, composite resins, that we can do minimal preparations and just place the restoration just right exactly where the cavity is, without having to do a retention, form.
Extension for prevention,
exactly.
Right.
So, and that will just give us the advantage of saving more tooth structure, really.
Plus, fluorides have cut down on decay, right?
Exactly. We are lucky in this country that we have fluoridated water. Unfortunately, some other countries they don't use it, and of course that was a great improvement in the total health of the population. Otherwise, so
sure.
Yeah.
Well, people want to contact your office. How do they do it? Where are you?
We are located in Sunrise, Florida. We are just a couple of miles from your office. It's 9200 Northwest 44th Street in Sunrise, and if you want to give us a call, it's 954-572-2750. We basically provide all aspects of general dentistry, from cleanings, simple fillings, extractions, up to restorations of full mouth.
Right.
And we do also preventive care.
Great.
So.
Well, again, I want to thank the two of you, because it's a joy for me to work with you. I work as a team approach. As I said before, I'm the surgical specialist, and I work with restorative dentists, and I do everything below the gum, and it's their job to make the beautiful teeth, and you guys are incredible at doing it. It's a privilege for me and my team to work with you. Now, as I mentioned before, dentistry today is not the same dentistry as your parents or your grandparents. Periodontics, my field, has changed tremendously. As I mentioned before, the use of a laser has cut down on a lot of the surgical trauma that patients experience. Patients are anxious regardless of their age. Everybody is a baby, no matter how big they are and how big and strong they are, when they have to come to the dentist. They've heard stories about generations ago how things were done at the dental office. And today, with sedation, we do IV sedation in my office. Even the most anxious patient can sit there comfortably, have only a pleasant memory of their visit to the dentist. For somebody who's having sedation, I could be working on them 3 or 4 hours, and at the end of the procedure, they'll say, I said, how did you do? They said, well, when are you going to get started? Or are we done already? Or, gee, I feel like I've been here only 10 minutes. It's a terrific modality for anybody to have the greatest quality of care with the least amount of anxiety and trauma. Most of our procedures are done at one time, so we can treat full mouths at one time. Now, when we have reconstructive cases where we have to rebuild the bone, we may have 2 or 3 procedures. But again, everything is done with 100% anesthesia, where the patients feel nothing, and the IV sedation takes care of all their anxiety. Our office, we've been here, as I mentioned before, 38 years. You can visit our website at www.drklevine.com. You can email me at drkenny@drklevine.com, or you can call us at any time for a complimentary, completely free examination, consultation, and radiographs. I look forward to seeing you and meeting you soon. Thank you.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.